Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This mycology lecture is about dermatophytosis. The lecture is divided into two parts, 1 and 2. This is part 1. When you finish part 1, go to part 2. The objectives of the lecture, by the end of this lecture, should be able to, number 1, define dermatophytes and dermatophytosis. Number 2, classify dermatophytes taxonomically. Number 3, classify dermatophytes according to their natural habitats. Number 4, discuss their mode of infection. Number 5, discuss the different clinical types of dermatophytosis. Number 6, outline the diagnosis, treatment, and prevention of dermatophytosis. Here there are some references for further reading. Before I go to the topic dermatophytosis, I would like to tell you here that how to write the name of a living organism scientifically. The name is composed of both the genus name and the species name. Example, Trichophyton rubrum. Here, Trichophyton is a genus name, rubrum is a species name. Both names are either underlined or written in italic. You see here, Trichophyton rubrum underlined, and below it, Trichophyton rubrum written in italic. Then we come to the topic dermatophytosis. It is a superficial mycosis of the skin caused by the fungi dermatophytes. Dermatophytes are moles. Here you see the word dermatophytes. The first letters, derma, means skin. The dermatophytes live in the keratinized tissues of the skin, that is to say skin, hair, and nails. They feed on keratin. They digest the keratin by the enzyme keratinase they produce. Taxonomic classification. Taxonomy is a science of classification of living organisms. Dermatophytes are classified into 3 genera, plural, genus singular. Number 1, Microsporum species. The fungi in this genus infect skin and hair. Number 2, Epidermophyton species. The dermatophytes here infect skin and nails. 3, Trichophyton species. The dermatophytes in this genus infect skin, hair, and nails. Dermatophytes are also classified according to their natural habitats, where they live. Some dermatophytes live in human. These are known as anthropophilics. They are the most common causes of human dermatophytosis. Example of them, 1, Microsporum odwini, 2, Trichophyton rubrum, 3, Trichophyton tonsurans, 4, Epidermophyton flocosum, 5, Trichophyton violaceum, 6, Trichophyton shorelinei. The dermatophytes that live in animals are known as zoophilics. Example of them, 1, Microsporum canis in dogs and cats, 2, Trichophyton equinum in horses, 3, Trichophyton verrucosum in cattle, 4, Trichophyton montagrophytes in guinea pigs. The dermatophytes that live in soil are known as geophilics. Example, 1, Microsporum gypsum, 2, Microsporum fulvum. Dermatophytosis, as I said, is a superficial mycosis of the skin caused by dermatophytes, also known as tinea or ringworm. The word tinea precedes the anatomical site infected. Ringworm is the description of the lesion because the lesion is commonly round. The disease is contagious. It can be easily transmitted from the source of infection to the healthy person to be infected. Transmission, how the disease spreads. The infection takes place by spores. The spores are the infective agents via direct or indirect contact. Direct contact of the person to be infected and the source of infection. The source of infection can be human patient, animal patient, and infected soil. Indirect contact through fomites, Fomites. Fomites are the things that are used by the person commonly, like clothes, shoes, hair brushes, and so on. They carry the spores from the source of infection to the healthy person to be infected. The spores can remain viable in the suitable environment for up to 12 to 20 months. Viable means alive and able to infect. The incubation period is commonly 1 to 2 weeks. The incubation period is a duration of time from the start of the infection up to the appearance of the disease. Warmth and dampness are important predisposing factors. They facilitate the occurrence of the disease. The clinical types of dermatophytosis. Clinical, from the word clinic, originally it means bed, B-E-D, and then modified to mean the hospital or health facility where patients are received and treated, and also the appearance of the disease, how the disease appears, and also the result of history taking and physical examination to the patient by the doctor. The outcome is a clinical assessment. Each clinical disease is named after the anatomical site affected, preceded by the word tinea. If the scalp is infected, the disease is known as tinea capitis. The disease is common in boys 3 to 8 years, but it may continue up to puberty, and after that it declines. It is common in boys, but quite rare in girls. The lesions are rounded. You see here, there are two whitish alopecia rounded scalp patches. Alopecia means having no hair. A hairy area when it loses its hair is called alopecia, from the word alopecia. The fungi that can cause tinea capitis, example, Microsporum odwini, Trichophyton sudanense, and this is an anthropophilic, Trichophyton tonsurans, Trichophyton violaceum, Microsporum canis, Trichophyton equinum, Trichophyton verrucosum, and still there are other fungi that can cause tinea capitis. Sometimes the fungus goes deep into the skin, reaching the viable part of the skin, initiating an inflammatory reaction, leading to pus formation, abscess. This is known as chirion. Bacterium is an exclusive disease of children. It occurs in the scalp. It is extremely rare in adulthood. You see here the picture on the right hand side. The arrow is pointing to uh, an area which is discharging pus. Bacterial infection are also common to be a secondary infection. Also, if the disease is not treated, it may lead to ulceration and scarring with permanent loss of hair. Hair infection. There are three types of hair infection. A, ectothrix. You see here, this is hair. The dark part is in the middle is the hair shaft. The covering is the hair sheath. When the fungus is found between the hair sheath and the hair shaft, this is known as ectothrix. Here, the cuticle of the hair is broken. The commonest cause is Microsporum canis. The second type of hair infection is the endothrix. The commonest fungus is Trichophyton tonsurans. Here the fungi are found inside the hair shaft. The cuticle is not destroyed. Here the arrow is pointing to the fungi. The third type of hair infection, Phavus or Tinea favosa. This is a chronic disease which may start during childhood and progresses to adulthood. It may take 10 to 20 years. The fungus goes deep into the hair follicle, leading to inflammatory reaction, resulting in yellowish secretion forming crusts. The crusts are known as scatula. You see here, the arrows are pointing to scatula. On your left hand side, they take the honeycomb shape. The commonest cause is the fungus Trichophyton shoreline. If the disease is not promptly treated, it may lead to permanent hair loss. Tinea barbae, this is infection of the bearded area and the mustache. The source of infection is commonly an animal. The commonest fungi are Trichophyton equinum and Trichophyton verrucosum. Tinea corporis, this is infection of the skin of the back and the non-hairy area of the body. It infects the trunk, and you see here there are large round lesions. The commonest causes are Trichophyton rubrum, Trichophyton tonsurans, Microsporum canis. Tinea cruris, also known as jock itch. The disease is very itchy. It is infection of the groin. It affects the perineum, the natal cleft. The disease is common among males, but females can also be infected. The commonest cause is Trichophyton rubrum, followed by Trichophyton mentagrophytes and Epidermophyton flacosum. By this, the lecture is over. And I hope that it is understandable, and I wish you all the best. And now you can proceed to part 2.